The symptoms you should be looking for are obviously pain. That's the biggest factor. Typically, pain is associated with the spinal stenosis can be mild, moderate, severe, or even super severe. And it may occur in the neck, the back, the legs, or in some cases, the arm. Now, there's also the symptoms of weakness or numbness. Numbness meaning you can't feel your arms, hands, legs, or feet, or even tingling in those areas, which can occur because the nerves may be compressed. Then there's also difficulty walking and balance issues. More common because of the low back, lumbar spinal stenosis that causes these symptoms in the leg when walking or standing, which may improve only when they're sitting or leaning forward. So there are many causes of spinal stenosis, one of the more common being degenerative changes, degenerative disc disease. Then there's herniated discs. That's the disc between the vertebrae or the bones, thickened ligaments. These ligaments support the spine and can thicken over the time and bulge into the spinal canal, putting pressure on the nerves and the spinal cord. Previous injuries or trauma to the spine can damage it that leads to the spinal stenosis over a period of time. Then there's the congenital factors or factors that are known people are born with. In some cases, these individuals are born with a natural spinal canal that is already more likely to cause them to have the symptoms later. Then people wonder, well, how do you diagnose this? Well, obviously to diagnose this, you're gonna wanna see a licensed healthcare practitioner who can help you. A thorough physical exam can help identify the tenderness, the weakness, and the sensory loss in those areas that it's suspected or you may or may not realize you have. Then people wonder, well, how can you see it? Can you see it on anything? Yes, you can. You can see it on imaging tests such as X-rays, MRIs, and CTs. These scans can provide detailed images of the spine to confirm the diagnosis and determine where the narrowing is and how bad it is. More often, the MRI and CT is what you need to really see that stenosis. You can do them with X-rays, but there are certain X-rays that people don't always take. It's easier to get that information from an MRI or CT. Then people wonder, well, how can you treat spinal stenosis? Well, there are a variety of ways you can treat it. The more conservative way of treating it is obviously using medications such as NSAIDs, non-steroidal anti-inflammatory drugs, and also physical therapy. The goal of physical therapy is to strengthen your muscles, improve your flexibility. In some cases, because of the inflammation and pain and the severity of it, a patient may need an epidural steroid injection in the area to give them relief in order to do more of the conservative options or even get more permanent relief. Then people wonder, well, what about chiropractic care? Chiropractic care can help. Chiropractic adjustments may be used to improve the spinal alignment and relieve pressure off the nerves. However, it's very important to understand that your chiropractor needs to have the experience and expertise in treating that spinal stenosis. Then there's the surgical intervention. That's when the conservative options, that's the medication, the injections, the physical therapy, the chiropractic, even the massage therapy, even acupuncture are not really helping. Procedures such as laminectomy, where they're taking pressure off the bone itself, cutting into the spine, or doing a spinal fusion may be recommended. Now, spinal fusion can be done in really any area, the low back, the mid back, the upper back, or the neck. The more common ones for low back for stenosis is fusing the back of your spine for fusion. In your neck, more common these days is to do the fusion in the anterior, the front, but it can be done in the back. For the upper back and mid back, some people preferably do it in the back area. Then people want to know, well, long-term management. Well, long-term management involves lifestyle modification. That means maintaining a healthy weight, avoiding activities that worsen the symptoms, using assistive devices like braces or canes to help manage the symptoms when they're getting bad at times. But then you also have to realize spinal stenosis can be considered a chronic condition for some people. So regulatory monitoring it and getting adjusted and doing some physical therapy or massage may be needed in order to manage the symptoms over time. If you suspect you have spinal stenosis or experience some of the symptoms of back pain, leg pain, with walking or standing, it's essential to consult a healthcare provider for an accurate diagnosis and appropriate management of it. Thank you for watching this video. Hopefully you found it informative, and if you'd like to continue educating yourself on how to lead a healthy, pain-free lifestyle, please subscribe to our channel and check out the links in the description for more videos.